This presentation is going to review Chapter 6 of the Patient Care Book, Vital Signs, Laboratory Tests, and Oxygen Administration. At the end of this presentation, students will be able to define vital signs and explain when assessment should be done, list the rates of temperature, pulse oximetry, respiration, and blood pressure that are considered to be within normal limits for a child and an adult male and female, describe any interfering factors that affect the normal values of vital signs, identify sites and methods available for measuring body temperature, identify the most common types of oxygen administration equipment and explain any potential hazards, describe all equipment used to monitor blood pressure, take temperature, and administer oxygen, accurately monitor pulse rate, respiration, and blood pressure, and explain the purpose of basic laboratory values such as blood urea nitrogen, creatinine, and glomerular filtration rate, also known as GFR. We will also perform skills labs in the classroom to test students' performance on obtaining vital signs from a patient. In many medical facilities, radiology departments often have radiology nurses instead of relying only on radiologic technologists to monitor patients' vital signs routinely. However, some hospitals lack nursing staff, therefore it's crucial that all technologists and students know how to monitor and document vital signs accurately. Recording this information in the patient's medical records or on the radiology requisition form is essential for patient care. The technologist must also understand how to use oxygen equipment and determine the correct oxygen flow rates based on the patient's condition. Because oxygen can be risky, radiographers must follow specific precautions when helping with its administration. Physicians' orders are not needed for measuring vital signs, but they are needed for administration of oxygen. When a nurse is unavailable, it's the radiographer's responsibility to take vital signs in situations like when a patient arrives for a test or treatment, before and after giving medication, and when the patient's condition suddenly changes, or if the patient feels unwell or different without clear symptoms. Taking a patient's vital signs, also called cardinal signs, is an important part of a physical assessment and includes body temperature, pulse, respiration rate, blood pressure, and pulse oximetry. It is the radiographer's responsibility to assess the patient's condition when you're performing an exam on them, whether it's an invasive procedure or just a general non-invasive X-ray. If you physically or visibly see a patient's condition change, it is your responsibility to obtain a set of vital signs and assess the patient's condition, and you would report this back to hospital staff. Also, if a patient notes that they are not feeling well, you can also perform a set of vital signs. It is standard procedure to obtain a baseline on patients prior to the start of an invasive procedure, and then their vital signs are checked throughout the procedure and oftentimes after the procedure. Also, vital signs are obtained before and or after administration of medications. This can include contrast material. The first vital sign we are going to discuss is body temperature. Body temperature reflects the balance between heat produced by the body and heat lost to the environment. It's crucial for efficient cellular function. Even small changes of 2 to 3 degrees Fahrenheit can affect bodily processes. The hypothalamus, located in the brain's basal diencephalon, acts as the body's thermostat. Metabolic processes generate body heat. Higher metabolism means more heat is generated, while lower metabolism means less heat is generated. Many factors influence body temperature, including the environment, time of day, gender, age, weight, hormones, emotions, physical activity, digestion, illness, and injury. Cellular functions and cardiovascular demands adjust with temperature changes. An elevated body temperature indicates fever or pyrexia, often caused by disruptions in the body's heat regulation due to illness. As fever increases, the body's oxygen demands rise, leading to symptoms like increased pulse and respiratory rates, discomfort, flushed dry skin, occasional chills, and reduced appetite. Prolonged high fevers can harm the central nervous system. Hypothermia can occur when the body's temperature drops below normal, typically indicating a health problem. Medical induction of hypothermia can reduce oxygen needs. Survival is rare if the body's temperature exceeds 105.8 degrees Fahrenheit or falls below 93.2 degrees Fahrenheit. Temperature is often recorded in Fahrenheit or Celsius. In the United States, we typically measure temperature in Fahrenheit. When discussing average temperature rates, they are broken down into infant, which is categorized ages 3 months to 3 years, children, which is ages 5 to 13 years, and adults, which is 14 years and older. A person with a body temperature below normal limits, as we discussed previously, is considered hypothermic. A patient with body temperature above normal limits is considered to have a fever. Normal ranges for an adult temperature are 97.8 degrees Fahrenheit to 99 degrees Fahrenheit. A child, ages 5 to 13, average temperature is 97.8 degrees Fahrenheit to 98.6 degrees Fahrenheit. And average temperature for an infant is 99 degrees to 99.7 degrees Fahrenheit. Body temperature is commonly measured in 4 different areas: orally, which is in the mouth under the tongue; tympanically, which is in the ear; rectally, which is in the rectum; and axillarily, which is under the arm. However, advancing technology has eliminated pretty much the use of oral and rectal measurements, and they are less common, and now they're being replaced by what is called temporal measurement, which is taken on the forehead. The choice of site for temperature measurement should be considered when evaluating the patient, whether the patient's age, mental status, and ability to cooperate. It's important to specify the measurement site when reporting temperature reading due to potential variations. As you can see on this slide, the normal oral measurement is 98.6 degrees Fahrenheit, whereas a normal tympanic measurement would be 97.6 degrees. And rectal readings are always going to run a little bit higher, for example, 99.6 degrees. Rectal measurements are rarely used in adults and are usually done only on infants. The axillary is the safest, but requires the arm to be held tight against the body, which often does not work well with children. Temperatures are typically recorded in healthcare settings as oral, tympanic, temporal, axillary, or rectal. Oral digital thermometers utilize heat sensors to accurately measure body temperature. This method is highly effective for obtaining precise readings in adults and children over the age of 4. The typical average body temperature reading is 98.6 degrees Fahrenheit. The thermometer includes a probe that is placed under the patient's tongue and held there until the device indicates it has recorded the temperature. The temperature inside the mouth can affect the reading displayed on the thermometer. Each time it is used, a probe cover has to be put on. The probe should be cleaned after each use as well. Axillary site is the safest method because it is non-invasive. An electronic thermometer is used. The probe needs to stay in the armpit for a few seconds, and precise placement with the arm held tight against the body is needed to attain the most accurate reading. The tympanic temperature, or also called oral thermometer, is placed close to the eardrum. It has a cover that is placed over the probe for each use. Then the cover is discarded and the probe should be cleaned. This type of temperature reading provides a close to core body temperature reading if the temperature device is accurately placed. A rectal temperature reading is considered the most approximate reading. It's closest to the patient's core body temperature because the area that the temperature is being taken is in the pelvic region, which is close to the core of the body. This method should not be used if patients are restless, have rectal bleeding, or hemorrhoids. The use of a blunt tip thermometer, specifically for rectal temperature recordings, is used. This type of temperature recording is rarely done on adults and is mostly performed on infants. There are two types of methods for taking a temporal temperature: the scanner method and the touchless method. The scanner method is more precise compared to the touchless method, but both are non-invasive, quick, and simple ways to measure the body temperature. The scanner method operates by balancing the temperature of tissues warmed by arterial blood behind the ear with tissues cooled by heat loss from the forehead. Temporal temperature readings are typically accurate within 1 degree Fahrenheit of oral temperature readings. When using the scanner method to obtain a temporal temperature, you're going to place a protective cap on the probe. You're going to position the thermometer at the center of the forehead and slide it straight towards either the right or the left ear. And then you're going to place the thermometer behind the ear nearest to it and wait until it beeps and record the temperature. When using the contactless method, you're going to hold the thermometer near the center of the forehead and press the start button. You're going to wait for the thermometer to read the temperature, and it'll usually have an audible beep. You're going to remove the scanner and record the temperature reading. Now we're going to move on and discuss pulse. The pulse is felt as the heart pumps blood into the arteries in a rhythmic manner, causing a throb or pulsation. It can be easily detected by gently pressing superficial arteries against a bone. You need to compress the artery slightly to get a thumping of the pulse. Don't press too hard or you will shut the blood flow off altogether and will not be able to feel the pulse. Then you're going to record the pulse in beats per minute, abbreviated BPM. There are 9 different areas where a pulse can be measured. The apical, which is the apex of the heart, heard with a stethoscope. The radial, which is at the level of the wrist on the side where the thumb is. Carotid, which is in the neck. Femoral, which is in the groin. Popliteal, which is in the posterior part of the knee or behind the knee. Temporal, which is in front of the ear. Dorsalis pedis, which is at the top of the foot. Posterior tibial, which is on the inner side of the ankle. And the brachial, which is at the groove of the elbow. The 2 most common methods used to obtain the pulse are the radial pulse as well as the carotid pulse. As you can see here, image A is the apical pulse that we discussed previously, and the physician or nurse or technologist is using the stethoscope to listen for that pulse. Image B is the radial pulse, which is taken at the wrist. Image C is the carotid. Image D is the femoral. Image E is the popliteal behind the knee. Image F is the temporal, which is just in front of the ear. Image G is the dorsal pedis, or pedal pulse, which is at the top of the foot. Image H is the posterior tibial pulse, which is the posterior part of the tibia. And image I is the brachial pulse, which is at the level of the elbow. Just like temperature rates vary for adults, children, and infants, so do average pulse rates. An average infant pulse rate is 120 beats per minute. An average child pulse rate is 90 to 100 beats per minute, and an average adult pulse rate is 60 to 90 beats per minute. Take note that adults are going to have the slowest pulse rate compared to a child and an infant, with infants having the highest. The pulse rate is a rapid and relatively efficient means of assessing cardiovascular function. 2 different conditions exist: tachycardia, which is an abnormally rapid heart rate over 100 beats per minute, and bradycardia is an abnormally slow heart rate, which is at about 60 beats per minute. So pulse rate and heart rate are interchangeable terms. The radial pulse is usually the most accessible and can be taken most conveniently on an adult. The pulse should be counted for a full minute because you need to find out the strength and regularity of it. A person's heart rate might skip a beat every 40 seconds, and you would miss that if you only do a 30-second count and multiply it by 2 to find the rate. When taking a pulse, be careful not to press too hard with the fingers. You don't want to completely shut off the blood flow, and then you will not get an accurate reading. You never want to use your thumb to count the pulse because your thumb has its own pulse. And you want to watch with a second hand so you can count to 1 full minute when obtaining a pulse rate. The respiratory system exchanges oxygen and carbon dioxide between the lungs and the blood. Oxygen enters during inhalation, reaching the alveoli where gas exchange occurs. Oxygenated blood carries oxygen to tissues, while deoxygenated blood returns to the lungs to be reoxygenated. Carbon dioxide is removed from the blood in the alveoli and is exhaled. Adults typically breathe 15 to 20 times per minute. Infants breathe 30 to 60 times per minute. Breathing fewer than 10 times per minute in adults can cause symptoms like cyanosis and altered consciousness due to inadequate blood supply. Breathing should be quiet, effortless, and regular. Factors like medication, illness, exercise, or age can affect respiratory rates. Difficulty breathing is described as dyspnea. Respiratory rate is recorded as breaths per minute, and an R is put in front of the notation so as to not be confused with pulse that is recorded in beats per minute using the same abbreviation. Average respiratory rates for an adult are 15 to 20 BPM, children ages 1 to 10, 20 to 30 BPM, and infants under the age of 1, 30 to 60 BPM. Respiratory rates, as discussed previously, lower than 10 BPM may result in cyanosis, apprehension, restlessness, as well as a change in the level of consciousness due to the supply of blood that is oxygenated being inadequate to meet the body's needs. Dyspnea is a condition when a patient is using more than normal effort to breathe. On the other side, your breathing rate will increase with exercise as well as emotional status like anger. Blood pressure is the amount of resistance of blood flow ejected from the left ventricle of the heart during systole and the amount of resistance the blood meets due to systemic vascular resistance. It is simply the flow of blood times the resistance of the blood vessels, which equals blood pressure. The number of red blood cells in the body and blood plasma determine the viscosity of the blood. With an increased number, the blood thickens or becomes more viscous, subsequently increasing the blood pressure. Blood pressure is recorded in millimeters of mercury, abbreviated mmHg. Blood pressure is measured with a device called a sphygmomanometer, providing 2 readings, systolic, which is during heart contraction, and diastolic, which is during heart relaxation. The systolic number is recorded as the top number, and the diastolic number is recorded underneath, so systolic over diastolic. Orthostatic hypotension can occur when a patient rises after prolonged lying down, leading to fainting due to a low blood pressure. Factors that affect blood pressure include age. Typically, the older you are, the higher blood pressure you get. Your weight. An individual who is overweight tends to have higher blood pressure. Men typically have higher blood pressure than women. Environmental factors. If it's hotter outside, your blood pressure can increase. In the afternoon, after being awake and moving around for a while, your blood pressure increases. After eating, your blood pressure increases. After exercise, your blood pressure can increase. And situations of stress also increase blood pressure. This slide reviews different types of devices that you will see to measure blood pressure. Mercury manometer, which is image A, and aneroid manometer, which is image B. the slide in the middle, which is just a stethoscope, which you guys should be pretty familiar with. And the image on the right is an automated blood pressure detection device. This is used in a variety of different departments throughout the hospital or an outpatient facility. There are two main types of blood pressure measuring devices, the mercury manometer and the aneroid manometer. Each includes a cloth cuff with an inflatable bladder, a pressure gauge, and a thumb screw valve for pressure control, and a bulb to inflate the bladder. The mercury manometer is highly accurate, but is being phased out due to environmental concerns. The aneroid manometer requires regular calibration against the mercury device for accuracy. A stethoscope is used for blood pressure assessment and typically includes a bladder and a bell. The bladder detects high-pitched sounds and should be held firmly against the skin, while the bell detects low-frequency sounds and is held lightly. Proper technique involves placing a finger around the base of the bell to ensure even pressure on the bladder. In diagnostic imaging procedures requiring continuous monitoring of circulatory status, automated vital sign monitors are used to measure pulse, blood pressure, and mean arterial pressure. We're going to discuss a few red flags for blood pressure. So don't perform a blood pressure on the same side that a patient has an arterial venous fistula for dialysis in. Don't perform a blood pressure on the same side that an IV may be placed in the antecubital fossa, or if a patient has had breast surgery on that side. Edema in the arm is also a concern, and paralysis on one side from a stroke. You should always use the good arm. Blood pressure should be taken on the left arm above the brachial artery, and that is preferred. Unless the patient has a red flag on that left side, then you can obtain a blood pressure on the right. Clothing must be removed from the area before placing the cuff of the sphygmomanometer on the arm so that the sound will not be obscured by the patient's clothing. The steps involved in measuring a blood pressure include rolling up the patient's sleeve to expose their brachial artery. You place the deflated blood pressure cuff above the elbow and position the cuff with the arrow indicating the artery over the brachial artery. Position the gauge of the sphygmomanometer on a flat surface or attach it to the cuff for easy reading. Locate the brachial artery at the center of the anterior elbow. Place the bladder or bell of the stethoscope flat against it. Tighten the thumb screw on the pressure bulb and inflate the gauge till it reaches 180 milligrams of mercury. You're going to slowly release the valve by loosening the thumb screw and listen for the first audible pulse beat. Note that the reading on the gauge where the pulse sounds is the first heard sound. That is the systolic pressure. You're going to continue to listen for pulsations until the sound becomes soft and changes or is no longer audible. You're going to record the reading at that point where the sound changes or stops. This is the diastolic pressure. When recording a blood pressure reading, the systolic pressure is the top number. It's the highest point during contraction. The bottom number is the diastolic pressure, or the lowest point during relaxation. And then you're going to write the blood pressure results as a fraction. For example, 120/80. Normal adult range for blood pressure would be a systolic measurement of 90 to 120 millimeters of mercury over a diastolic number of 50 to 80 millimeters of mercury. Any numbers within these range in combination of systolic over diastolic are considered acceptable. An adolescent range for systolic is 85 to 130 millimeters of mercury and a diastolic of 45 to 85 millimeters of mercury. For a child, a systolic range of 90 to 120 millimeters of mercury over a diastolic of 50 to 70 millimeters of mercury is considered acceptable. There are different stages of abnormal blood pressure. There is stage 1 hypertension, which is a systolic blood pressure reading of 130 to 139 millimeters of mercury, or a diastolic number of 80 to 89 millimeters of mercury, or a combination of the two of these. Stage 2 hypertension is when a systolic reading is 140 millimeters of mercury or higher, or a diastolic reading of 90 millimeters of mercury or higher. If a systolic pressure is over 180, or a diastolic is over 120, or a combination of both, this is considered a hypertensive crisis and immediate medical attention should be sought. Hypotension is when a systolic blood pressure is consistently less than 90 millimeters of mercury. This is considered orthostatic hypotension. Oxygen is vital for brain function, and survival without it for 4 to 5 minutes is critical. The body relies on continuous external oxygen supply since it cannot store it. The lungs exchange oxygen and carbon dioxide, primarily transporting oxygen bound to hemoglobin. If supply is suddenly interrupted or interfered with, it is an emergency. It is the technologist's responsibility to make sure oxygen tanks are full and nasal cannulas as well as oxygen masks are available in the department. Disrupted pulmonary function leads to hypoxemia or low blood oxygen and hypercapnia, which is high blood carbon dioxide. Levels below 60 millimeters of mercury or hemoglobin saturation under 90% indicate inadequate blood oxygenation, requiring immediate medical attention based on observable symptoms. Pulse oximetry is used to monitor oxygen saturation within the blood. Patients who have the conditions listed on this slide will have less than normal oxygen saturation and may need to have that checked to see how the medication is working, or if they are on a ventilator, how well it is working. Normal SaO2 values are 95 to 100%. Values less than 85% indicate that tissues are not receiving adequate oxygen. The little portable oximeter isn't as accurate as the one on the left, which is hooked to an automated vital sign machine, but is efficient enough when a quick assessment is needed. The patient in this picture has asthma, and that might really be her oxygen level, or it might be the polish on her fingernails that is giving a low reading. Her heart rate is 78, which is somewhat fast. Remember that the heart pumps harder to supply oxygen to the body, so maybe her level really is that low. Oxygen can be helpful and hazardous. Oxygen is considered a medication and must be prescribed by a physician. Severe oxygen toxicity can occur and may have irreversible damage. For example, excessive amounts of oxygen to a patient with COPD may depress the respiratory drive and the patient may stop breathing. Also, bacteria thrive in oxygenated places, and if the tubing is not changed frequently for patients, the patient may generate a bacterial infection. Also, it is important to consider that oxygen is extremely flammable and supports fire, so oxygen tanks should not be around open flames to avoid a fire. The nasal cannula is the most common type of oxygen delivery system that you will see on a variety of different patients. Patients can also have an oxygen mask with or without a bag attached to it. If the mask is used, it often makes it uncomfortable for the patient, and they cannot eat or drink with it on and have a difficult time communicating. Babies in the NICU may have oxygen tubing that is connected and inserted into the nostril and taped in place. This avoids being pulled out or displacement of the oxygen. In addition to the nasal cannula and the face mask, other methods are in place to deliver oxygen to patients. One way is through a transtracheal tube, and it is a tube that is inserted into the trachea and delivers oxygen straight to the lungs. Also, ventilators are used to keep patients breathing. You'll often see these in the ICU. Oxygen tents are used in small children and babies who may have a difficult time keeping an oxygen mask on or a nasal cannula in place. You may also have patients that come in with their own oxygen system that is portable and they carry a small tank around in a bag. Also, in departments, you will see wall oxygen units. You will also have these in a variety of different radiology rooms, in addition to tanks that you can move in conjunction with your patient. You always want to be careful when transporting oxygen tanks that they don't fall over. There is usually a holder on a wheelchair or on the bottom of a stretcher. On this basic chest x-ray, the patient is being diagnosed with pneumonia. Pneumonia is a condition in which a patient may need to be temporarily prescribed oxygen until they get better. This is an AP chest radiograph where the patient is on a ventilator. As you can see where the arrow is pointing, the ventilation tubing is going across the patient's chest. This patient is more than likely in the ICU, and this image was taken with mobile X-ray equipment. It's important when imaging a patient with accessory devices such as oxygen or on a ventilator that all tubing is moved out of the way, not to obscure the image and show up in the anatomy. Radiologic technologists should be familiar with certain types of laboratory data in order to administer contrast material to patients. Contrast material may be used in special procedures, in diagnostic imaging, in CT studies, MRI studies, as well as in interventional. Some lab results that we should be familiar with include BUN and creatinine, red blood cells and hemoglobin, platelets, and prothrombin time and partial thromboplastin. The kidneys control the pH level of the blood, which is critical to life. When the kidneys start to shut down, the body is not able to rid itself of toxins in the blood and death will ensue. There are 3 different tests that can be measured through the blood to assess the kidney function. Creatinine levels are done with a blood test, and if they are increased in values, that means the kidneys are not getting rid of the waste product from the metabolism. Think about it for a minute. If your kidneys are not working to get rid of what your body uses, how will they be able to process contrast media if it's injected? It's going to cause an overload on the body. Also, blood urea nitrogen, abbreviated BUN, is the waste product from what we eat. Once our kidneys filter blood and the waste is eliminated, there should be very little blood urea nitrogen. And a third function is the GFR, also called glomerular filtration rate, which is a test at how fast the kidneys can filter waste. GFRs have a tendency to decrease with age. On average, patients over the age of 60 can have a lower GFR. When speaking about ranges, normal range of a creatinine is 0.6 to 1.2. A normal BUN is anywhere from 7 to 20. BUN will increase with dehydration, and a normal GFR is over 90, with younger people having a higher GFR and older people having a lower GFR. Doctors select tests to help diagnose blood disorders based on a patient's symptoms and the results of a physical examination. Sometimes a blood disorder causes no symptoms but is discovered when a laboratory test is done for another reason. For example, a complete blood count, also called a CBC, is done as part of a regular checkup and may reveal low RBC or red blood cell count, which is an indication of anemia. When a blood disorder is suspected, a CBC and other tests may need to be done to determine a specific diagnosis. The blood test most commonly done is CBC. The CBC is an evaluation of the cellular components, red blood cells, white blood cells, and platelets within the blood. Automated machines do this test in less than 1 minute on a small amount of blood that is collected. There are other blood tests that are performed for different types of symptoms that a patient may be presenting. The radiographer must be aware of these tests and what the values can mean, particularly when performing procedures that require the administration of contrast material. During minimally invasive procedures that are performed in interventional radiology, it is often important to know if a patient has a disorder of the blood that may cause problems with excessive bleeding, and the clotting factors need to be evaluated. This is done with a simple blood test. During interventional radiology procedures, the femoral artery can be catheterized in order to see blood vessels in other parts of the body. Once the catheter is removed, the patient may bleed from the puncture site. With a low number of platelets, the site may not clot successfully. Other blood tests that are performed to determine clotting time and ability are prothrombin and partial thromboplastin. In conclusion, vital signs consist of recording body temperature, pulse, respiration, and blood pressure, as well as oxygen saturation. Many different variables can affect vital signs, such as the time of day that they are taken, gender, age, weight, illness, environmental factors, physical activity, and emotions. Oxygen administration can be performed using a nasal cannula, a face mask, catheters, as well as a ventilator. Oxygen can be hazardous. It must be ordered by a physician. It is flammable, and it can be toxic in patients with certain diseases. Lastly, a variety of different lab tests can be performed to evaluate a patient's condition. Lab tests that assess for kidney function include BUN, creatinine, and GFR. Blood disorders can be assessed by evaluating red blood cells as well as hemoglobin. Clotting factors can be assessed, in particular with patients who are undergoing a minimally invasive procedure, and include evaluation of platelets, prothrombin time, and partial thromboplastin.